Okay, let's get started. Today, we are diving deep into a really critical part of the body, super complex, fundamental to life itself, the chest, the thoracic cavity.
It really is. I mean, think about it. Heart, lungs, the major blood vessels, nerves, it's all packed in there. Understanding its anatomy isn't just academic, it's foundational for so many areas of medicine.
Absolutely. And our source material for this dive really gets that. We're looking at Dr. Atef Ahmed's 100 questions and answers about anatomy of the chest. So our mission today is kind of twofold. Figure out why mastering this area is so vital and how this specific Q&A format actually helps people learn it.
Yeah, and what's interesting, right, is that it acknowledges that just, listing parts isn't enough. The complexity of the chest, it comes from the relationships between things, how they all work together. The mediastinum, for example, it's incredibly dense.
Hmm.
Understanding not just what's there, but where it is relative to everything else and why that matters. That's the challenge.
Right.
Right.
Exactly. And that seems to be where a resource like this shines. The source highlights Dr. Ahmed's approach, using questions to really drive the learning. It's not passive.
Precisely. It's all about active recall. Applied reasoning. Instead of just laying out facts, it poses questions. Questions that make you dig in, retrieve the information, apply it. It simulates, the kind of thinking you need clinically or for an exam. It's designed to make it stick better than just memorizing lists.
Okay, so let's get specific then. What sort of ground do these 100 questions actually cover? Does it really get into the nitty-gritty?
Oh yeah, it's pretty comprehensive for the chest region. It goes from surface anatomy, like the landmarks you can feel, thoracic topography,
Yeah.
to the really detailed structure of the chest wall, the diaphragm. It covers the lungs, pulmonary anatomy, segmentation.
Which is crucial for imaging and surgery, I imagine.
Totally critical, yeah. And it gets into the mediastinal compartments, what's in each one, and of course, a big focus on the heart chambers, vessels, and those complex nerve pathways running through the chest. Think phrenic nerve, vagus nerve.
Wow, okay, that's a lot. But you mentioned it's not just the questions, answers are key too. How do they go beyond just like giving the right name?
Right, and this is a really important feature the source points out. The answers aren't just answers, they're detailed explanations. They don't just stop at naming a structure. They integrate that anatomy with the physiology, how it works, its clinical relevance, maybe how it pops up in a common condition or procedure, and even pathological correlations.
Okay, can you give us an example, like how would it handle something?
Yeah.
Say, the diaphragm.
Good one. Okay, so a question might ask about its nerve supply
Right.
or what passes through it. The answer wouldn't just say phrenic nerve. It would likely explain it originates from C3, C4, C5, the mnemonic C3, 4, 5, keep the diaphragm alive.
Mm-hmm.
It might trace its path down through the thorax, explain its role in breathing, that's the physiology bit, then connect it clinically, maybe explaining why a high spinal cord injury is so dangerous for breathing.
Right. Ventilator support.
Exactly. Or maybe how diaphragm irritation can cause shoulder pain that's referred pain, a pathological correlation, all via the phrenic nerve. See how it connects those layers?
Yes. Okay, that makes total sense. It's so much more useful than just diaphragm equal the phrenic nerve. You understand the implications, the why.
Precisely. It builds this sort of multi-layered understanding. You're not just learning facts in isolation, you're seeing how it all connects in a functional living system.
And the source also mentions visuals, which, yeah, I guess are pretty essential for a packed area like the chest.
Oh, absolutely critical. It mentions numerous precise anatomical illustrations. Think about trying to understand the bronchial tree branching inside the lungs or the great vessels twisting around in the mediastinum.
Just from text. Difficult.
Yeah, very difficult. Clear illustrations are indispensable. They let you visualize those 3D relationships in a way words alone just can't.
So with this kind of focused, layered approach,
Mm.
who is this really for? Who benefits most from this deep dive method for chest anatomy?
Well, the source is quite specific. It mentions medical students, obviously, prepping for exams, residents needing to solidify that core knowledge for practice, instructors looking for, interactive teaching tools, and practicing clinicians too, folks committed to keeping that anatomical edge sharp.
But it sounds like it could be broader too.
I think so. Honestly, if you're just someone really curious about how this complex medical knowledge works, how it's applied, maybe you know someone in healthcare, or you just want to understand the incredible complexity of your own body, exploring how this knowledge is mastered, this method, could be really relevant for you too.
It definitely sounds more like a practical training tool than just a standard textbook.
Hmm.
Can we just quickly recap those standout features we've touched on?
Sure. So key things are 100 high-quality, targeted questions. Then those rigorous answer keys detailed, but more importantly, integrating the anatomy with physiology, clinical bits, pathology, hundreds of clear illustrations for visualization.
Portability was mentioned too.
Yep, designed to be portable. And critically, authored by Dr. Atef Ahmed, an experienced surgeon, which brings that practical clinical viewpoint.
Right. So the overall aim, the big goal described in the source.
It's really about pushing learners towards genuine anatomical mastery, not just recall, helping them reinforce the foundations, but also expand their ability to apply those anatomical principles in clinical situations. Functional anatomy, basically.
And that loops back nicely to why understanding this region is so important for everyone, really.
Hmm.
This approach shows how to really grasp it, function and all, not just list the parts.
Exactly. It makes learning active. It forces you to connect those dots, structure, function, clinical impact in a really practical way.
So we've really unpacked how Dr. Ahmed's resource uses these targeted questions, these rich, integrated answers and visuals to help master chest anatomy. It's a great example of active learning tackling a tough subject.
Yeah, it really lays out a structured, pretty effective path for anyone needing to navigate this vital anatomical territory.
Okay, so as final thought for you listening, just consider the sheer density in there, the intricate connections inside the chest. Think about the pathways of those huge vessels, the branching airways, the web of nerves coordinating everything, all crammed into that space. How does that incredible complexity and the need for such precise knowledge to understand it really highlight the body's amazing design and maybe how critical this kind of detailed applied learning is in healthcare?